Hello, my fellow YouTubers. This is Karen's Weight Loss Journey 63 and VSG. I'm on day 18 of post-knee replacement surgery. I have a brand new left new knee, and it's coming along just great. I'm wearing my stockings that they put on, to prevent my blood clots. I'm taking my Coumadin. I've been cleared to go to physical therapy outpatient once starting Monday, and I also have to go to the lab now on my local lab to get my blood tested. No more nurse visits, no more physical therapy visits at home. I'm progressing nicely on day 18. The doctor did tell me that the first 2 weeks you're going to curse me, you're going to tell me why the hell did I ever do this, you're going to be in a lot of pain, and you're going to regret it, but I have no regrets now. No regrets at all. Because once the healing process starts, then you rapidly recover. I have my good old blood clot forbidding stockings on. I'm taking my Coumadin. I want you to say hello to Bill. Bill? Bill? Hi, Bill. Come over here and say hi to the people. Oh, I guess he doesn't want to. Where did he go? Oh, there he is. Hi, Bill. How you doing? Hey. Anyway, we had a tragedy in the family. We have 2 cats, Their names were Bill and Hillary. Don't ask. They were 11 years old, and Hillary developed a bad, we thought was an infection in her eye. We tried to treat it for about 6 or 7 weeks. We had 6 different prescriptions we gave her. She finally had to have surgery to have the eye removed. And when they removed the eye, they told us, Karen, she's got a lot of cancer and it's gone beyond the eye. So we had to put her down. And now Bill is kind of missing her, but it's hard to tell with cats, They're so independent. They really are. He's been really extra cuddly lately, so maybe that's an indication. He wants to try to jump on my lap right now, and I don't want him to do that. Anyway, oops, he's playing with the string. Anyway, I just wanted to let you know, guys, that I am feeling great. I'm feeling much better than I was last time I spoke to you, and my recovery's going well. Let me just show you my stockings, my wonderful blood preventing, clot preventing stockings. Here they are. Ta-da! See? That's the knee I had operated on. And this is pretty. The swelling's going down. The scar goes from here, just above my knee, all the way down to just below my knee. It's about a 10-inch long incision, but it's healed up nicely. My stitches came out yesterday. Everything is progressing great. Now, when I went to the hospital, Bill. When I went to the hospital, I had gained, when I come out of the hospital, I had gained about 4 pounds because I got so much IV fluids because my blood pressure went way down while I was there. They had to keep pumping me with the IV fluids, and I had kind of passed out twice while I was in there because my blood pressure plummeted. But I tend to run low anyway. Now that I've lost over 70 pounds, I don't take blood pressure medicine anymore, and my blood pressure does run a little low now. So I have to be careful of that. Watch when I get up, don't get up too quickly because you might get a little lightheaded. And when you're sitting too long, get up slow, things like that. But I'm on Coumadin because I have a cancer history, and because of the vertical sleeve gastrectomy. For 6 weeks after this knee surgery, you have a chance of getting blood clots, and blood clots in your legs can actually travel to your lungs and create what's called a pulmonary embolism, and that can be a life-threatening thing. That's why they have me on Coumadin, because of my cancer history and the fact that I cannot take a lot of aspirin because of the vertical sleeve gastrectomy. After 6 weeks, when they take me off the Coumadin, they're probably going to put me on a baby aspirin for another month, but that'll be okay to take a baby aspirin for just a month. You should always consult with your doctor, though, to make sure that whatever medications you're on are ordered by other doctors, that it can, it coincides with your vertical sleeve gastrectomy, and that it doesn't counteract for anything. So that's my little advice today. Regrets? I've had a few, but then again, too few to mention, because I am not regretting this knee surgery at all. I kind of questioned it a little bit, like the doctor told me, the first couple of weeks, because it was a painful. You know, when you think of it, this is what they do during knee replacement surgery. The bottom of that big bone in your thigh, the femur bone, they cut the bottom of it right off. You know how like when you get a Christmas tree, a real one, at Christmas, and they saw the bottom of the stump off? That's what they do with the femur. They saw it off. And the big bone that's in your shin bone, the tibia, they saw the top of that off. And what they do is they put a plastic piece over each end, so that creates a joint space. And then they take your kneecap and they move it, and they shave the back of it, and they put like a disc behind it, so that everything is a nice big space again. He showed me that on the x-rays yesterday. It looks really different than it did before. It looks like I'm going to have a great success with this recovery, and my knee is going to be feeling like a bionic woman before too long. It will take another couple months or so before I don't even think about that I had knee surgery. But right now, because on day 18 I'm feeling so much better, I'm really optimistic that I'm going to make a full and complete recovery. As far as the IV bags, when they gave them to me, I actually did gain, like I said, the 4 pounds. But since I've been home now, I've lost like 5 to 6 pounds. I'm not sure how much, between 5 and 6 pounds. I'm 5'5", and I'm now at around 195 pounds. My goal was to be at 175 when, like I never wanted to be skinny. You know, your goal is not to be skinny, to be unhealthy. Your goal is to look good, to feel good especially, and to have a normal BMI. I don't have a normal BMI yet. My BMI is still over 30. I need to get that down. So until my BMI gets to be between 25 and 30, I'll consider that my victory when that happens. If I happen to weigh 175 pounds when my BMI is that way, then I'm going to be considered I've been at my goal. So it's kind of hard to predict. I don't go by how much weight I need to be at when I get there. I'm kind of going by more of my BMI when I get there. So that's what I'm striving to do, get my BMI under 30. It was way over 40 when I started this journey, so I'm really steadily decreasing it and getting healthier. And with my new knee, I'll be able to do more exercises, be more flexible, get more activity in, and that's my goal. You know, at 64 years old now, I have a new lease on life, and I'm going to make the best of it. Anyway, I didn't have much else to say except that I did go to the doctor's yesterday. He did take out my stitches. My BMI is still above 30, which I need to get it down a little bit. It's not far above, but it's there. And I'm on my way to a better health, better weight, and a better lifestyle. Until next time, when I speak to you, I'll probably have an official weigh-in then and let you know what else is going on. But my knee replacement is great. I recommend it to anybody. If you can get by that first 2 weeks, you got it made in the shade, baby. You guys take care. I love YouTubers. Spread love and be kind. Bye-bye.